Hey, I'm Quincy and I'm a radio personality, but just like you, I'm always wanting to make better health choices for myself and of course for my family. Now that's why I've teamed up with my friend Dr. Dean Tindall and the fine folks of New Life Naturopathic, the creators of new-lifeweightloss.com, to bring you a podcast focused on giving you the information you need to make the best health decisions for you and your family. Now, that's going to be without sway from what mainstream medicine has become. Now, this podcast, Pursuit of New Life, we're going to release one each Friday. And we're going to focus on debunking the mainstream medicine myths now associated with naturopathic, holistic medicine, while giving you clear insight into ways you can make your health a lifestyle and not a jump from fad diet to fad diet. Experts in the fields of biochemistry, chiropractic, physiology, women's health, and much more will weigh in on a range of topics, all designed to open your eyes, expand your knowledge, and bring you to new life. Now be sure to subscribe to Pursuit of New Life on all the podcast platforms, and also follow us on YouTube at newlifenaturopathic.com, and be joining us every Friday for Pursuit of New Life. Welcome to another episode of Pursuit of New Life. We are so thankful that you've stopped by the program. We are trying to find ways to break the paradigm of where we have come to think of mainstream media, or not media, I get in other discussions about that. Mainstream medicine is what they try to call it, and they try to change our perspective by calling it that. I'm Quincy. The panel is here from New Life Naturopathic, Dr. Dean Tindall, Dr. Julia Stuber, and we also have, of course, Mariam. We're the only two without initials in front of our name, but we love to talk about these things because they're interesting and also help us very much. So today, we are going to be talking about the failure of modern medicine or mainstream medicine or whatever they want to brand or they want to put on it. So Dr. Tindall, as the leader of our intrepid band here, why don't you tell us a little bit about what we're going to talk about today and why you're passionate about it?
Well, we see patients, at first the healthcare system, as a chiropractor and naturopathic doctor, where you're seeing a lot of people that the traditional healthcare system has failed utterly and completely. Like I said in the previous episodes, when we get a patient in to work on them, we get to work on their original problem. We get to work on the problem that the doctors have created, and even with all that against us, if the patient listens, like the lifestyle dietary changes, lifestyle modification, doing targeted supplementation, a lot of those people actually get better when they follow through and they follow our advice.
Right.
So we're just going to discuss a little bit some of the stats and things that are going on with the healthcare system. I haven't been actually in the mainstream healthcare system since 1996. So Dr. Stuber and Mariam are going to be able to discuss more of what they've actually seen on a personal level. I'll discuss things that I see in research and as a practitioner level, seeing how those people are coming to us and how they're all broke down and all the problems that they're having because of the treatment that they received.
Well, one of the things you were talking about before we got started recording today is you said you had a patient come that needed your help, needed your advice. You ran the panels and they took their panels back to their doctor, and their doctor was like, I've never even heard of some of these tests. So
yeah,
that's a good example of the problem, right?
Yeah, that's an example of problem because it's what I tend to see. I call in the modern medicine, probably in the last 20 to 30 years, it's being really driven by the pharmaceutical companies. Because what the doctors, I call it doctoring by numbers. What they do labs, and most of them, they don't even know what the labs mean. So, and then what happens is they look at a number and then want to give you a drug to change the number, like blood pressure, like when we deal with blood pressure problems. Most of the times it's not cardiovascular. It's liver, it's kidney problems, it's things like that, because these are filters and these filters get clogged and messed up, which then increases the blood pressure. Diabetes, damage to the cardiovascular system. There's some of that stuff there. But what happens is they're trying to change a number and they're not actually looking for the underlying cause of why that number's in the abnormal ranges. And that's what we do as far as naturopathic, is we're trying to look at what's the cause. And then we address that a lot of times with chiropractic and naturopathic care, because that's actual health care. What we practice in America right now is sick care. We wait till we're sick. that we try to seek intervention, it's very costly and it's very, um, you know, it's not a really good way to live life, just in
Right.
general.
Yeah, it's Band-Aid approach for sure. Dr. Stuber, do you want to chime in on the problem that we're discussing today, this failure of modern medicine?
Oh, absolutely. I practiced in Florida, so y- Florida is the home of managed care. It started in Orlando, back in the early 90s, and I think the initiative was by Hillary Clinton. And so I watched very quickly medicine change.
Mm,
It went from doctors trying to be as good as they could to insurance companies controlling just about everything that doctors do, what they prescribe, how they prescribe it, when they prescribe it, how often you have to go to the doctor. It became a copay system.
mhm.
And what happens is that, you have the most intelligent people in society, in my opinion, controlled by a businessman. It's all about money.
Right.
And they're just hanging in there to survive. It becomes about volume, 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 and not about quality. So I just really saw the lack of coordination. Like nowadays, it used to be the family doctor really treated just about everything. And it was with emergency medicine or life threatening conditions that you were sent to a specialist. And there just weren't that many kinds of specialists. Again, your family doctor handled just about everything, knew you by name, knew your family.
Hmm.
And nowadays, if you have a problem, you go and it's like, oh, well, you got to see this specialist. So the specialist, they have to refer. You have to wait in the referral department. Then you have to wait 6 months to get into the specialist. So if you weren't sick before, my goodness, you got something else wrong with you by the time the doctor prescribed the wrong medicine. And you tried to get the medicine and oh, you call the doctor the medicine. I could just go on and on.
Or
So,
because of insurance, you have so many hurdles you have to get over before you can see a doctor that you need to see. And then that insurance problem also creates all kinds of things too. That might be a whole nother
absolutely, and
episode,
the
though.
staff, the levels of staff that the doctor has to employ and try to manage, then they have to involve business people. And the bottom line is it's not about the patient anymore. It's not
Mhm.
about you and your problem. It's about money and how to keep the office open and how to keep the lifestyles going. And we just throw more and more medicine at problems that are not getting better, they're getting worse. They're becoming, instead of
Mm,
acute things that with a temporary, medicine is supposed to be temporary and work you towards health and then work with you to maintain health. And now it's one medicine leads to another medicine. It's about disease. It's about, oh, let's control the disease instead of,
mhm.
hey, let's help you back to health and have a quality of life. And like I've told people,
Yeah.
well, you might not be sick, but go to the medical doctor and you will be sick when you leave. So,
Yeah.
um, I mean, one way or the other. So, um, I I don't know if I treated people from all over the world. So I listened to what they experience in other countries. There's a few rare exceptions that, in my opinion, they do good care, but it's natural first. It's natural treatments
Mhm.
that lead to lifestyle changes that lead to a long, happy, healthy life. Um,
Yeah.
so
Well, we're going to dive into some of those costs and some of those differences between the U.S. and other countries. But before we get to that, I want to ask Mariam about something you actually just said, Dr. Stuber. You talked about volume versus quality. And Mariam, you experienced that in the healthcare education system. So let's get a little bit of perspective of that because that's the ground, that's the ground floor, if you will, of the problem because they get trained to come up in this system.
Absolutely. And I was kind of whirling my head while Dr. Suber was speaking, just kind of remembering my own experiences, my personal experiences uh, as a, uh, future healthcare provider, as well as from a patient's perspective, because I mean, we're all patients too. Um, so, when I was pre-med and kind of just thinking about what path I wanted to go into, and guess at at the end whether or not I even wanted to, And part of the process and decision making and kind of what deviated me away from it was what I experienced was the lack of morality and kind of the dissipation away from how can we be humanitarian and how can we help society get better and healthier. And it became more and more about, just what Dr. Stuber was saying. And we all know this, very money driven and just for all the wrong reasons. Healthcare has gone around all the right reasons and is working on those. And again, especially the pharmaceutical companies and insurance companies, those are the decision makers, not the doctors.
Mhm.
Who wants an insurance company to make your healthcare decisions for you? I know I don't. I don't trust those people. No offense, they don't know anything about my health, and they probably don't care either. Let's be honest. Um, so it was very sad to kind of come to that realization, but it definitely helped me come to a consensus and a better decision of where I wanted to go and the path that I wanted to uh, go to instead, which ended up being what we're doing now. Um,
So it was
and
sad to see the curtain pulled back on that stuff, but now that you have had your eyes open, you're kind of glad for that experience. Is that what I'm hearing?
oh, absolutely, yes. All of the above.
Go ahead, Dr. Tindall.
Very remember when we we first met each other and we are talking about doing this stuff. You're talking about school. Do you remember what you told me when you were going through the university healthcare system and you're shadowing the doctors and you asked the question, what makes a good surgeon?
Yes, because I wanted to go into surgery or anesthesiology. Yeah, their answer was, you have to be an asshole. Or I'm sorry. Let me rephrase this.
Wow, that's how they said.
Be a-hole, okay? Let's just for the purposes of
That's the first beep button for this podcast. I'll use the beep button for that. Yeah.
My apologies.
No, that's a
word by
direct
word.
quote. Yeah.
I'm not even paraphrasing. I'm not paraphrasing.
Wow. And so I mean, that kind of was a rude awakening then, even in the same sense as you're seeing the curtain pulled back on some of the politics of it. Even in that response, like that's not what anybody wants to be part of.
Absolutely. Yes. And just kind of the nightmares of what I saw from the insurance companies, we've all heard of the pre-existing condition rules and just how messed up it is. A lot of the time, I've seen this happen directly and indirectly with the insurance companies when it comes down to what they are or are not willing to accept. Sometimes it is a life or death decision, and they end up getting denied. Why?
Yeah.
Because of money. And that was another awakening for me. I did not want to be a part of that system.
Wow.
So yeah,
Well,
it's
eye-opening indeed, either in just hearing about it. So Dr. Tindall, let's go ahead, since we're talking about insurance, which means, spending money. Let's talk about these numbers that you and I were talking about what is spent per capita on healthcare, and let's kind of discuss that. I think this is a good opening for that.
Yeah. So if you look in America, we spend the most on per capita for healthcare, which is actually sick care, in other developed countries. And a big portion driving of this, and I should have given you stats earlier, but the United States makes up 4.8% of the world's population. And depending on which person, which thing you read, but we consume 70 to 80% of all the drugs in the world. Yeah. So, and then we kind of have a joke that we tell around is, MDs stands for more drugs, more death. Because when you look at drugs in America, prescription drugs are the third leading cause of death in America. But when you add in deaths from surgeries and hospital care and all these other things, improper care, wrong diagnoses, unnecessary surgeries, the numbers about a medical profession, our current medical profession in the United States, roughly kills around 1 million people a year. That's not healthcare. That's just,
it sounds like death care, like trying to.
It is.
These are true stats.
Yeah.
And about the insurance aspect of it, we get a lot of patients say, "Hey, does insurance cover naturopathic treatment?" I tell people, no, it doesn't. Now, some of the people's
because it works.
Yeah. Well, the other thing is medical savings accounts. Some medical savings accounts will pay for like the labs that we do and some of the supplements that we do, and may pay for their care, but we do not bill, and we do not. I tell patients, you do not want insurance covering the services that we provide, and the reason is just like what Mariam and Julie said earlier. When the insurance companies pay, they get to decide like level of care, treatment, and all these things, and
because they're technically paying the bill, even though we're paying them. Yeah.
And the thing of it is you got someone who's got a high school education on the other end of the line telling people that, you can't have care. Oh, I'm going to approve this or approve that. And actually, trust me, I've been on the phone and I've worked my way up some of these corporations and state agencies because I'm kind of the type of guy what I'm a little bit of a crusader. So there's an old saying that principal can be an expensive mistress. I'll pay her. Yeah. I've gone through, spend hours on the phones going through these processes of saying, look, you're telling me what I'm going to do for my patient. I'm going to tell my patient what I'm going to do for you. You're going to cover their care. That's what we're trying to do with our naturopathic treatment is we're trying to teach people that, I think it was Benjamin Franklin said it, an ounce of prevention is worth a pound of cure.
Mm-hmm.
And then another phrase that I'm going to paraphrase, I believe it was Voltaire. He said, the problem with modern medicine is you're using drugs you know very little bit about, on disease you even know less about, on people you don't even know. And so what we're trying to do especially when we're doing our naturopathic care, some of our patients complain about the paperwork, and I tell people, look, I don't know you. We don't know you. We're trying to get to know you. We're trying to see what your symptoms are, what your problems are, because a lot of your conditions that you have and are not testable. And you have to understand, and this is old school doctoring that you used to do in the past, that you would sit down, listen to the patient, examine them, look at them, and then you come up with a working diagnosis. And the diagnosis is just our best guess. But the more information you can get from their labs, their history, and what they're eating, and all that stuff helps us as practitioners figure out what's their underlying cause. And that's a big difference between what we do, chiropractic, naturopathic medicine, and the other side of the healthcare paradigm is they're managing numbers. We're trying to find the cause to get rid of the symptoms and get rid of your problem, and not have to take expensive drugs and
right.
And you're causing problems. Because if you said earlier, Quincy, if you listen to the commercials, they're worse than the original problem most of the time.
Yeah, we were talking before we came on about drugs and how that impact on healthcare, which that's probably a whole nother episode by itself. But we were talking about all of the side effects, and I was like, yeah, if you even listen to the commercial, more than half of the commercial is what happens if you take this. And oftentimes, if it's like, say, depression medicine, one of the side effects is depression. or death. And
worse depression. Worse depression than what you had before.
Or like metformin. Metformin, we did a little reel, Dr. Stuber, we did a little reel on metformin and black box, death, okay? And then all the side effects, and you're scrolling through it. Or you can eat better.
Go figure, right?
That's part of why we put our eating program together, the new-life-weightloss.com is, we've been, like I said, I've been doing this for a lot of years. Julie's been doing it for a lot of years. And the biggest thing that people have lost the art of cooking. The internet there's so much bad stuff out there. When we were like putting these together, and we were doing some of the, like say we get some recipes for smoothies, and we put all our food through our recipes through a nutritional calculator because we're trying to get in balance as far as carbohydrates and nutrition and stuff. And some of these smoothies were coming back at 70 to 100 grams of carbs. Well, a human being only needs about 75 to 100 per day to be healthy. And when you get excess past that is when you start having obesity problems and blood sugar handling issues. And that's why, our program is basically, in a nutshell, is to design to balance blood sugar levels so that you keep your insulin levels down. Insulin is a very damaging hormone in our body when it's in high doses. And that's part of the testing that we do because most medical doctors don't test for your fasting insulin.
Well, and they haven't seen half of the tests that you run, as we figured out earlier.
Yeah.
So Dr. Stuber, give us maybe an example of where the healthcare system we're talking about that has failed. Give us some of the success of what you're doing with naturopathic and chiropractic services that you've seen so far since you've been with New Life Naturopathic.
Well, the biggest difference is that we're treating the patient and not the disease. And it's amazing when you give somebody the foundations of what the body needs to heal and repair and function, how quickly the body will heal, and what happens when people do the right things, they change their lifestyle, they change dietary habits. It's exponentially better. People start and they have doubts. And I've seen miracles in about 4 hours. An example I had was I've been treating a man who's been very sick with, they don't know what, the medical doctors, what they believe he has is absolutely ridiculous. He would be dead by now. Well, he was running 103.5 fever in bed, and he'd been that way for 3 days. And I worked with his wife and gave him some natural supplements, and he's had this fever off and on for a month. I mean, the amount of blood work that the medical doctor did that, in my opinion, wasn't right. 3 hours, and she wrote me, it's a miracle his fever is gone.
Wow.
And if that doesn't show what the proper nutrition and the proper balance of things does, I don't know what does. But regularly, I see those kind of results. And with the results, I mean, the proof is in the pudding. The results are what matter.
Yeah.
And how about the young lad that you've been working on that's had the real bad seizures?
Oh, yeah. Same. It's the same family. He has seizures from a fever starting about 5 years ago, and he's now 10 years old. He had one visit, and we discussed it. I've read through all of his medical records, which I kid you not were 6 inches. And then she came in and gave me more. And you get to the point, I asked her, well, where all has he been? And she's like, I don't even remember. Here's his records. And I understand that. You get to where you just don't even know, where did I go? What am I taking? Why am I taking it? Well, anyway, he hasn't had a seizure since the very first time I prescribed the natural supplements, and it wasn't that much. I mean, it was under $200. Wow. Which his seizure medicine alone is over $3,000 a month.
Lord have mercy.
So, and like a lot of people, you have a copay, you have a deductible, and when your child's sick with seizures from a fever, that's life-threatening. What do you do? I mean, you sacrifice and you try to make it work. And it doesn't work. It just gets worse. So miracles happen every single day that honestly are miracles. It's just make the body function properly with even the proper nutrition.
Yeah.
And things happen, positive things. I mean, it's life-changing, life-altering forever. As a young man, I mean, his life has changed forever.
Yeah. His life changed because you changed his mother's life. And
exactly. I was going to say, taking the stress off of, I have a passion for women, obviously, because I've lived it. And I know what it's like, a mother's love. There is no other. In my opinion, there's no stronger bond. When your child's sick, or when you're afraid every day. Oh, and the side effect of his seizure medicine is suicide. And she started experiencing that shortly after he take the medicine. So we had the discussion, and she broke down when I said, I can imagine as a mother, it's terrifying either way. He could die from the seizure, or he can kill himself from the medicine, and he was 9 years old.
And now his
So
life
do
has
you ever
changed.
sleep? Yeah, I mean,
Yeah.
how do you have children? How do you ever sleep? You're watching them all the time. It's no quality of life. So she's been switched, can't take care of her family. So it's really been revolutionary and a miracle for the entire family.
This is what holistic naturopathic medicine can do. And Mariam, let me ask it this way to you. This is the kind of story that you left the, quote, mainstream medicine for. So give us some perspective on experiencing this through New Life Naturopathic, and why this is so rewarding and why you are continuing down this path.
Yeah, absolutely. So, yeah, I was about maybe 2 weeks away from taking my MCAT, and
Right.
at the same time, I was shadowing and volunteering in hospitals and doctors' offices, and just kind of rotating, uh, trying to figure out what path I was interested in. And I kind of, because I had incentives from family as well, to kind of go on that track and kind of push me, to be a doctor so they can brag and say, "Oh, my daughter's a doctor." And then, and I knew this whole time, just all the things that I had accumulated, and all of the knowledge and experiences. And I start to feel I started to feel guilty. I had this huge guilt upon me, say, "This is not right." Because my family doesn't know what I know. They haven't seen what I've seen. They haven't experienced my experiences. Um, and I need to really think about that. So I had, I looked at all of my books, and I kind of wrote down like some of my memories of all the pros and cons, all the reasons of why I did it. And every time I would remember one of these stories of, like the salespeople from the pharmaceutical companies, trying to take all these doctors out to lunches and talk them into whatever drug costs the most and is going to make them the most money. And I just said, no, no way.
Yeah.
And so I didn't take the MCAT. I was 2 weeks away from taking it, and that I probably would have done okay, but to me, it was not worth it. That was reason enough. I wanted to be proud of what I wanted to do, and I wanted to back it up with good morals, and I just did not feel right about continuing on that path. And so I couldn't be happier with that decision now.
Well, with what Dr. Stuber just explained and the stories she just told, your parents can introduce you as miracle worker instead of doctor, and I think that's a little better.
I think I like that better.
I like that better too. Well, we're going to be wrapping up this episode, and Dr. Tindall, we've talked about healthcare versus sick care. We've talked about the failure of modern medicine, what New Life Naturopathic can do if people will take the mystic side of what mainstream has tried to paint it as. If they can get all that out of the way and just come and have a conversation with someone like yourself, or go to newlifenaturopathic.com and see what there is, what would you want people to get out of this episode to understand, this failure of modern medicine and why holistic naturopathic care is the way to go?
Because I tell people naturopathic care is the original medicine. It's been around forever. Herbs have been around forever, ever. We're actually more science-based than medical doctors in most stuff. For example, just real quick, turmeric has over 23,000 research articles on it. Omega-3 fatty acids have over 30,000 research articles on it. Lipitor, maybe 12,000, which is the number one prescribed drug in the United States. So when they tell, the doctors like to poo-poo us and say we're not scientific with our voodoo, but we're not. We're actually more scientific. We're more science-based, and how we've practiced and how we're doing things it's based in physiology. Dr. Stuber left us already, but she was scanning through cancer, prevention of cancer. Guess what it was? Lifestyle and dietary changes.
Mm-hmm.
That was the number one recommendation for prevention of cancer. Chronic diseases. I reading a research article on chronic diseases. Guess what? It's called lifestyle medicine. Guess what it is? It's doctors coaching patients how to eat, how to exercise, and how to do lifestyle modifications. I'm like, wait a minute, that's us. That's what we're doing. All the recommendations are saying
we do that every day. Yeah.
Because the thing of it is we are as naturopathic doctors, and we are trained to do nutrition and naturopathic work. Kind of back to what I tell people about education. We're trained in this area of nutrition. That medical doctors are trained in drugs and surgeries, and you have doctors in different areas. I'm not going to go to a dentist to get open heart surgery if I have to have open heart surgery. I'm not going to go to a chiropractor if I have to have my hip replacement surgery. You know what I'm saying? So what you want to do is you want to take what's going on with you. If I'm sick, I want to go to a doctor who's actually going to find out the cause of my sickness and disease processes and try to fix those. And I'm not anti-drug. Drugs are good for short-term stabilization of patients. Well, what we do is long-term, and it takes time for those changes to occur in most cases.
Yeah.
And that's kind of the difference is, you're here to get you healthy, or we're looking at when we're looking at you. I want you to be healthy until the day that you die, and I want you to be doing it naturally. And I want you to have a vibrant life. I want you to have a full life. I want you to be, like I tell all my patients, I want to be 106. I want to do something really stupid when I die. I want to spend the last couple of years of my life sitting in a bed because I thought a donut was more important than eating healthy.
Mm-hmm. Well, these are all powerful things that we're talking about because we want people to get this information and understand that there is other options out there than sick care. You can actually have a lifestyle change that gives you health. You can go, instead of going from fad diet to fad diet, you can find these wonderful meals and weight loss and all of the great things that come with it at new-lifeweightloss.com. Great place to go. newlifenaturopathic.com give you more information about some of the things we've been talking about on these episodes. But at the end of the day, give holistic, original medicine a chance, as Dr. Tindall said. And we're going to be talking about some more of these topics. Today we talked about the failure of modern medicine. We've talked about some other things over the course of several episodes now, talking about different things like what makes naturopathic different. We've talked about other things about the labs and all of this stuff. We're doing this to put you in a position to make good decisions for your life, and stories like Dr. Stuber told about lives being changed in moments can be done by making lifestyle decisions instead of trying to patch things up with medicine and Band-Aids and surgeries and things like that. So, folks, team, we've made it through another episode, and we've got more coming. We're so glad that folks have come along here for Pursuit of New Life, and we would love for you to stop by any of your favorite podcast platforms, and also New Life Naturopathic on YouTube. You can look that up and check out the website at newlifenaturopathic.com. And if you're listening by podcast and you want to see the graphs and the website spelled out and all that good stuff, just find us over on YouTube. Good place for it. So we'll see you next time on Pursuit of New Life.